You can definitely have a very healthy pregnancy and a healthy baby when you have MS. And we know that the period of pregnancy is actually a really good time for people with MS from a disease activity point of view because of the way that the immune system adjusts to the pregnancy itself. Relapses and MRI lesions, all of those things reduces during pregnancy and reaches its bottom level usually by the second trimester. There is also no evidence that having MS affects your fertility or has any effect on the growth of the baby itself. So the only things that we do talk about a fair bit when we start talking about family planning with our female patients with MS is to talk about the after delivery period. So in the first 3 months after delivery, we know that in that period of time, especially if you don't restart your medication, you could have a bit of a surge of inflammation, and that is an increased risk period when you can have more relapses again. And then the other thing, of course, that requires a lot of discussion is to talk about what do we do with your treatment before you get pregnant, because obviously we try and limit exposure to drugs during pregnancy. And we have to balance very carefully, what disease activity we can tolerate versus, the risk to a baby when you have ongoing exposure to some treatments.